from the College by the Lake, Coeur d'Alene, Idaho. Local, regional, national, and international guests discussing the issues and topics affecting the way you live are on Forum, the North Idaho College Public Forum, with your host and moderator, political scientist Tony Stewart.
The subject for today's program is death and dying. Recently, PBS nationally has done a very outstanding series looking at different cultures around the world on how those different societies look at the process of death. We have a real expert from Coeur d'Alene, Idaho, to be with us to talk about in this country the whole process, and certainly that has a relationship to how other countries perceive the question. I welcome to the program my very good friend Dexter Yates, who has many credentials to come to this program. For many years at North Idaho College, he taught a special class for us entitled Death and Dying. He also was on the board of directors of Hospice of North Idaho for many years and was very, very helpful to that organization with his expertise. And he is the owner and director of Yates Funeral Homes here in this area. Dexter, we've had you before on this and other issues. It's always a pleasure to have you on our program.
It's good to be here again.
And it's a pleasure to have Janelle Burke, who is a regular member of our panel, to join with us today in questioning our guests on this very, very significant subject. And I shall ask Janelle to commence the questioning.
Well, Dexter, you and I have been acquainted for a long time, and I know you're very sensitive to the needs of people with regard to this issue. Why is it that we need to talk about this issue? Why do people need to talk about death and dying? Why do so many people want to hide that fact?
Well, to answer your first question, why do we need to talk about it? I think that we need to realize, first of all, that we can't talk about life and living unless we talk about death and dying. If we're talking about life and what we find meaningful in life and goals and ambitions and purpose, if we don't consider death, which is part of the definition of life, then we're really not going to be able to deal realistically with those issues about living. The second question, why do people avoid it? I think that people avoid it because they fear it. And anything that we fear, we try to avoid. It's too bad that we can't get more people to get through that process of fear to discuss it, because they'll find so much more meaning in life by accepting death.
What about a family that suddenly finds out that someone in the family is seriously ill and possibly terminal? Should they deal with this question at all levels of the family? For example, the parents, the children, the grandchildren, if there are grandchildren, all levels. Should children be introduced to this subject as well?
There might be some argument with that, but I'm a strong advocate of honesty at all levels, at all ages. First of all, parents need to understand how children perceive of death at certain ages. They can get help with that. There are a lot of professionals that would be willing to speak with parents to let them know what children are able to understand. But once you know what children are able to understand at the different ages, then by all means, honesty, truth, open discussion about the subject, what's going on, and allowing them to be part of it. Isolating someone who's dying from grandchildren by putting them in another environment, which might be some type of a special care unit that removes them, even though the care might be needed. Isolation takes place when parents don't allow the children to go to where the dying person is to visit with them and interact with them.
Sometimes people think they're protecting the child, perhaps, but could that actually evoke more fear than if the child is there to see what's going on, and even though it may be unpleasant at times, the child begins to understand the process?
There's definitely a lot of protecting going on at that level. A number of years ago, I hate to talk about how many years ago that is, because then we go back to how long we've known each other. And when I think back of some of the educational seminars that were going on 20 years ago, a sociologist at one point coined the phrase protection of childhood experiences and gave some examples of what we do to protect our children from pain. One of the protection issues that he was speaking of is the death issue, the dying issue, the illness, the aging, all of those things. And by doing that, what we do is we do not give our children any history, any experience, any resource to call upon later in life when there's even a more significant death, so that they have had some of those feelings. They know those feelings are normal. They have had some some process to go through with assistance from parents in dealing with it. And the mistake that we make is if we protect our children at that age, and then sooner or later they're going to have to deal with it, then where is the support later? And where is the history, and where are the credentials, the resource to call upon to get through it? That's a big problem.
I want to quote from Newsweek magazine. My researcher is always providing me some data, and then let you react to it because it is a follow-up on what Janelle is asking you. In quoting from this Newsweek article, the author said, "As a health-obsessed society, we do not know what to do with death other than to control it." The author goes on to say, "Virtually no one has confronted the central problem. Our determination to prolong life has distorted the mission of even American medicine." Would you elaborate upon that again? And I guess I would ask it from the viewpoint, our cultural system in looking at death is very different from some others. Are we one of the more difficult societies of facing that question and also being so youth-oriented?
Yes. I think a central issue today with our society, if you were to come up with one word that would describe how we view it, how we look at it, it would be anxiety. There's basically four parts to that: death fear, death avoidance, death denial, and reluctance to interact with the dying. And that gets back to that control again. We try to control it, and without really getting back to the central issue, which is that we're all going to die. That's the one thing that we know for sure, that it's going to happen to all of us.
That's one thing that every human being has in common.
It's the one thing we have: death and taxes. And we know that's going to happen. And one of the ways that we control it, by the way, is with humor. And it's a way that we can reduce it down to a level that we're comfortable with. We learn that, for example, when we're in junior high. I can remember, for example, as a youngster in junior high with the bully of the school, and I feared him because I didn't know if he was going to be waiting for me in the alley on the way home, like he often did for other kids. And since he was a couple of years older and much larger, I had that fear. And one of the ways that I could control that was when there were others around and I knew that we weren't alone together on a one-on-one, then I would make fun of him. And I could reduce him down to a level that I was comfortable with by joking and with humor. And we find that as a defense mechanism that we learn as youngsters. Making fun of other children that we might fear. A new girl comes to school and she's prettier. Our perspective is that she's going to be taking away some of the boyfriends, so some of the girls decide to make fun of her, and maybe she's a little bow-legged, and they'll say, "Oh, we could hang her over the door for good luck," those kind of things. Here again, teasing, making fun of because we fear. We learn those things as youngsters, and then when we get older, one of the ways that we can control death, which we fear and we don't know that much about, is to, when the subject is up, we laugh about it, we joke about it, and we never get down to the issue.
Something that you're so eloquent on, and I want to bring that up at this time and share it with the viewers. You have had to deal with a lot of individuals that have learned that they were dying when you were with hospice, for example. Let's suppose that someone has been to the physician today and has got what for them is very, very shocking news that they have not been feeling well and they have a terminal illness. And the doctor has to give them the news that in his or her judgment that maybe the maximum time they have left is 6 months. From that moment of getting that news, there is a process that you talk about what they go through, and I wish you'd share that with our viewers, taking through each stage that most individuals go through and how they move from one to the other.
I think what you're referring to is the 5 psychological stages of dying that Elizabeth Kubler-Ross introduced to us in her book on death and dying, I think it was back in the 60s. That's the process that's been widely accepted by a lot of caretaking professionals. And I think it's important before we do that, and we'll do that briefly because we could take the rest of the program on that subject, but before we do that, I think the important thing to point out is that, like you said, that most people would go through. And it's not that everyone would go through it, and it's not that we would all go through in exactly that same order. And the most important thing to realize is that we can have reoccurring periods. We don't just go from step A to B and all the way in, and without falling back and going up and back. So it's we need to talk in more of stages rather than stages, as a series of emotions that can occur and that can reoccur.
I would just interject too, I would assume age would have something to do with if someone was 85 years old, they wouldn't deal with it the same way as someone who was 20.
Yes. So let's begin with denial. Those 5 psychological stages are denial, anger, bargaining, depression, and acceptance. Denial being an initial response, no, not me, having difficulty accepting the fact that this could be real, it could be final, it could be true. And that denial can be the denial of the disease itself by saying, no, I don't have the disease. It can be the acceptance of the disease, but the denial that this disease is going to kill you. It can be, okay, I have cancer, but I'm going to beat it. As opposed to the person who says, I don't have cancer, I'm going to go to another doctor, get another opinion, and keep going and going and going until we finally, hopefully, find someone that says, no, you don't. And then, that's the person I want to believe. So that's what is referred to as denial. It could be, a third one could be accepting the fact that you have the disease, accepting the fact that it's going to kill you, but denying the fact that it's going to happen in 6 months. That yes, this will kill me, but only when I'm ready to have it do it at age 94. And as we work through that process of denial, the next stage that she talks about is anger, which in a lot of ways is a healthy sign because it allows those who are in the family and the caretaking professionals to see that this person is at least accepting the fact that they are ill and that they're going to die. Otherwise, they wouldn't be angry. And this anger sometimes can be directed at healthcare professionals because the person might feel that somehow with America and the money that we spend on research and we put men on the moon, that why can't we have cures for these diseases? The anger can sometimes be directed at the person themselves. They may have been told, stop smoking, stop doing this, and yet we continue, so we can get mad at ourselves. And the anger can be directed at God. If we can't find anybody else to blame for this, we can maybe turn our anger towards Him. And then the third stage or process I would rather refer to is the bargaining, which is maybe bargaining with the doctors or bargaining with God that give me just another month, another year. We have talked just briefly before the show aired about those significant dates and how important it is to live through those, like the graduation of a daughter from college, or seeing a son get married, or seeing the first grandchild born, or spending Christmas at home because all the family's coming back. And a lot of times the bargaining is not for the cure. The bargaining is just simply, can I get through next Christmas? And if so, this is what I'll do. Maybe I'll leave some money to the church, God, if you will help me get through an extra month. So that's kind of in a nutshell, that's the bargaining process. And of course, depression. I guess the best way to explain this is all of us have had a loss, whether that loss is real or imagined. And we know what it's like to have something that's very precious to us and lose it. We could lose our job, we could lose our home, we could lose our parents, we could lose our health, we could lose our youth, a number of things. Keep in mind that when someone is dying, they're losing everything. They're losing their children, their job, their home, their parents, their friends, all of the things that are important and significant, they're losing. So if we know what it's like to be depressed, certainly we can understand how depressing it must be to lose it all. Acceptance. I don't like that word. It's the word that's used. But somehow I feel that acceptance occurs up closer to where we have anger. But that particular stage is an implication that at this point good communication takes place because we've gone through a series of emotions. The dying person is at a point where they can openly and honestly talk about their dying, want to resolve some conflict. Relationships become very important, and it's important for family members and those relationships to be at that same level that the dying person is, so that good, open, honest communication can take place. But a word that I like better is resolution. Resolve to the fact that we're dying. Having worked through our anger, having worked through some guilt, having worked through some depression, and even though it may reoccur, may be depressed again, may get mad again, but at least resolve to the fact that it's going to happen and communicate, keeping in mind the fact that it's going to happen and not skirting around the issue.
Thank you. Janelle Burke.
Well, that was so good. I hesitate to ask the next question, but I think I must. In this day and age, there are many divided families. Also, people are living much longer, and that means that there's the likelihood that people will marry more than once or twice, and that families will be combined that previously had no particular background together. So what happens then when there is a death of a loved one? How do we solve or resolve the differences that different families might be bringing together in the way they want to handle the arrangements and so forth? Or even there may be disagreements between members of the family. How do you resolve those differences?
It's probably the most difficult issue that we face as funeral directors today. It's something that we were not trained for. I am glad that you brought this subject up, because when we talked several years ago, this was not a predominant situation that it is today. The reason being that the blended family was a younger family in terms of its history years ago, and so there weren't people dying in that blended family as often as they are today. So today the funeral director, the care provider, the people who are involved with aging and dying and death are now coming into an arena with a different family, a family that does not have tradition, a family that does not have history, a family that does not have the so-called leader who people go to. Oftentimes the person who dies is the one person who is the catalyst that's holding all the other members of the family. It's the only common denominator that they have with each other. An example being that a father who gets divorced and ends up with his children marries a lady who gets divorced and ends up with her children. The children are thrown into a situation of being brothers and sisters. If the father dies, now what relationship do the children have as brothers and sisters? His children may then go back to their mother, which will break up that family even further. So I think one of the things to realize is that with the divorce rate and with people living longer and remarrying, because a spouse may die and a wife may live longer and healthier, that we're going to have this large family, which becomes the blended family. And without that history and without that tradition, there's a struggle for territory. Who gets to make the decisions? And it's not an easy issue to deal with.
Put you oftentimes in the middle of that too, since that's the first contact after the death itself, when those decisions have to be made. Would you advocate that there be some training in this country for funeral directors and others, since this is becoming a different kind of society in relation to what you've just described?
Yes. I really feel a need for it. I've brought it to the attention of our association, and within our industry we see workshops and seminars coming up from time to time now that we can go to learn mediation skills. We become the mediator, the arbitrator. Oftentimes what we have done in serving a family that may be at odds with one another is to have one of the funeral directors deal with one segment of the family and another funeral director deal with the other segment, so that both families are getting a fair representation from our firm, not feeling like they're being slighted, because it's very difficult to be dealing with a new wife when we have the old wife and the children here and the mother and the father over here, and everybody has needs, everybody loves this person. We want to take care of all those needs, but yet the law says certain people have the rights to make the decisions. And those laws don't always take into consideration the true relationships. They take into consideration the legal relationships. And changing the law won't help.
It's just really complex. We've been so fortunate in this program over the years to have so many people, and you and I were reminiscing before the program that we're in our 22nd year and some of the kind of people we've had. And I didn't mention that at the time, but one of the people that I remember very, very well, in fact about 2 years ago, was a Dr. Raymond Moody, who wrote, among other books, Life After Death. And he's a medical doctor and a psychiatrist. He's got a remarkable background, and he's done a lot of research and interviewed people all over the United States for many years now that went through near-death experiences where during surgery the heart stopped or wherever it might be, and the person was revived. And there's some common testimonies about the kind of experiences they have. And so my involved question to you would be, do those kind of experiences and those kind of books, are they helpful to individuals who are terminally ill or families who are coping with this problem? Do we need to address, to some extent, out of what you said earlier, this fear and this anticipation of not knowing? We all like to know what's going to happen at any point along the way. Is that helpful?
As you were speaking, I thought instantly of a situation that happened to me a number of years ago, and you mentioned my involvement with hospice.
Yes.
One of the hospice caregivers a number of years ago became ill himself with cancer. And in his last days, he wanted to talk to someone who he felt would not be judgmental, would not laugh, would not be critical about an experience that he had had. And it was the out-of-body experience and the tunnel and the light. And he said, I so want to share that with someone, because he said, you know, I'm kind of just a regular guy, and I don't go for that kind of stuff, and if somebody heard me say that, they'd think I was crazy or I'd flipped out. And he said, I've kind of held it all these years, and I've never said anything to anybody. And he made an appointment just to come to see me, just to tell me about it. It had nothing to do with his dying. It had to do with something that happened a number of years ago in an accident, but now he was going to die. And he wanted to be able to share that story and not feel threatened by my reaction. He just trusted me and thought that, well, because you work with hospice and you're a funeral director, then maybe you're going to listen to me and you won't think I'm a kook. And as you were talking, I just instantly thought about that and thought, this poor man who would like to have shared that story with other members of family and friends, and probably felt he was the only person that had ever had such a thing, and wouldn't dare say anything to anybody. So yes, I think that, you know, when we have those types of things that happen, and those things that can be discussed openly and honestly and communicated, they're very helpful. It's again that whole process of communicating feelings, which are part of experiences, and not worrying about someone being critical of how we feel.
I just also have to ask, because I talked to one person who, in fact, had been on this program, who had had that experience as a fairly young person, and after she was revived, she said she had no fear of death after that. Did that impact how he was taking his own dying experience?
Yes, tremendously. That was part of what he got into later, was then letting me know, because of that his cancer and his dying was not as difficult a process, and that other people were wondering why he wasn't maybe reacting in a typical way that others had. And he said, it's because I have full confidence of knowing where I'm going, and I have no fear. So it was a tremendous influence on how he did his dying.
Janelle Berg.
Time always goes very rapidly on this program, but one of the things that we like to do is let people know where they can get help. If there is someone out there who's watching, who has had an experience recently with death, who perhaps is very concerned about handling this process themselves, perhaps it's been a loved one in their family, or maybe it's someone who's going through it themselves, where can they go for help? Where can people find help? And particularly if it's been a death of a child, where can people find help?
My first recommendation is always going to be, if the people have a church home, that they go to their pastor. I just feel that that's going to be the first starting point and the best starting point.
For dealing with the grief.
For dealing with the grief. If they have no church home and yet they feel that they are part of the Christian community or have some spiritual grounding and don't know who to go to, they can ask a friend. And here again, I'm getting back to, I think, as a starting point, a pastor is a wonderful resource. Pastors will refer. So I'm saying that that's a starting point, and sometimes it doesn't need to go any further. Another person that comes to mind, because first of all he was a pastor, was Bob Newcomb, who was a pastor for a number of years with the St. Mark's Lutheran Church in Hayden Lake. And then Bob went into counseling and is now with Lutheran Social Services. And so that's another place where I think they could be referred.
If I could just interject too, there's so many different organized religions here and all over the world, and so whatever religion one would have, going to the synagogue or the church, the cathedral, every organized religion has experts to cope with this whole question. But again, if I could go back to follow up on Janelle, if one is not associated with any organized religion, and you were getting into that when I interjected, but where else could they go?
Then I think getting a good recommendation from maybe a friend or one of those resource people as to what's available in the community. You know, we have a number of excellent psychologists and psychiatrists in the community, to where if the grief process becomes an abnormal process rather than one that just needs a helping, listening hand to work through, but if it gets to that point where it's abnormal and there could be some potential destruction going on, and there's obviously an altered pattern of behavior and a personality change, then we need to get to the true professionals that work us through that process. And we have a number of qualified people in the community as well that can.
In other communities. I've got to signal we have less than 2 minutes, and I don't want to let this get away, but you just triggered that in my thinking. I know it's not the same for everyone, but when should a family worry about a member that's not handling it well? When has a person grieved in a very intense way too long? What are the signs when someone needs help?
Boy, that is probably the most difficult question. And let me just answer it this way, that a lot of the things that are abnormal at some point are normal in an earlier stage. And it's like anger. When anger, which is normal, becomes extreme hostility over a long period of time, then that's dangerous. The difficulty is being able to tell at what point that happened. I can't tell you. All I can do is tell you that at this point it's okay, at this point it's not, somewhere along the line.
Well, I must interrupt. We're out of time. Thank you very much on behalf of Janelle Burke. It's been most informative. We'll have you back at some other time, Dexter. Ladies and gentlemen, I know you have found this to be a very, very important subject to you, and I'd like to invite you to be with us again next week at this same time when we will discuss yet another topic. Until then, please have a good week. I am Tony Stewart.
The North Idaho College Public Forum was videotaped live from the studios of Telemedia Services on the campus of North Idaho College for viewing at this more appropriate time. We invite you to join us again next week for another all-new edition of the North Idaho College Public Forum on this public television station.